2, 3, go.
Hello class, my name is Tyler Barteld and I will be talking to you about one of the most important things that you can do to become a more successful person. Although it is often overlooked, a good night's sleep can be that final step that you need to take to becoming the more successful person that you want to be. So in this speech today, I'll be talking about some ways that good sleep can affect you positively, some sleep disorders that can prohibit you from getting a good night's sleep, and some ways that you can move past a sleep disorder. So a man by the name of Joe Leach, who is a dietitian and who has a master's degree in nutrition and dietetics, wrote an article talking about 10 ways that getting a good night's sleep is positive for your body. And one of the points that I felt spoke to me the most talked about how getting a good night's sleep can help improve productivity and concentration. And the way that he proved this is by talking about a study that was done on medical interns. And in this study, it found that interns who got less sleep made on average 36% more medical errors than interns who got the recommended amount of sleep by their hospital. And this is pretty scary because when you want a doctor that is on the scene and you want him to be on top of his game, but in today's society, more and more doctors are getting less and less sleep. So it proves that some doctors will most likely not be on the top of their game, or at least as best as they could be. So in this situation, we talked about how a job can keep you from getting enough sleep, but in other situations, there are sleep disorders that keep you from getting enough sleep. And in the book called Fundamentals of Sleep Technology, they define sleep apnea as a disorder that obstructs the airways so that you are not able to breathe clearly for at minimum 10 seconds. And there's two different parts of sleep apnea. There's obstructive sleep apnea and central sleep apnea. And obstructive sleep apnea is the more common of the two. That's when the soft tissues in the throat relax while you're in REM sleep, and they relax to the point where they're obstructing your breathing, and it keeps you from having clear breaths. And so in minor cases of obstructive sleep apnea, it'll show as just snoring or just loud breathing while they're sleeping. But in more severe cases of obstructive sleep apnea, it'll show to where the soft tissues in the throat relax to the point where they close off completely. And in this case, the body will forcibly wake up because the brain is not getting the necessary oxygen it needs. And this can happen repeatedly in a night. And when it does happen more than once, it gets to the point where the person is not getting the necessary amount of restorative sleep through REM that they need. And they're also having that oxygen desaturation that is unhelpful to having the correct amount of oxygen you need. So on the other side of sleep apnea, there is central sleep apnea. This is not so much an obstruction of the airway, but rather it's the brain not sending the correct signals to the body telling it to breathe, or not sending consistent signals. And so in this case, it is similar to obstructive sleep apnea in that they are both limiting the amount of oxygen that you're able to bring in, and it's also creating that oxygen desaturation that we had mentioned before. So hospitals have been figuring out different ways to solve these problems, and one of the most successful ways that they have found is through positive air pressure. And in the book Principles and Practice of Sleep Medicine, there is a man by the name of Colin Sullivan who basically came up with the concept of positive air pressure. And his machine gave birth to the two machines that we use most commonly today, is the CPAP and the BiPAP, which I have here, which is courtesy of the main coordinator at the sleep lab in OSF's hospital in Escanaba. And so the main similarity between CPAPs and BiPAPs is that they both use positive air pressure to open up the airway and to let air in while you're sleeping. But the differences between the two is that CPAP uses one singular constant air pressure throughout the whole night, while a BiPAP swaps between two different air pressures, one higher one for when you're inhaling and one lower one for when you're exhaling. And the way that the BiPAP and CPAP machine work is that they both have a mask that hooks up to your face and is strapped on throughout the whole night. And they have a tube that attaches to a little like base where the water sits. And the water goes up to about there. And the machine creates a positive air pressure. And in this case, this is a BiPAP. So it'll create two positive air pressures that it swaps between for when you inhale and exhale. And that helps to open up your airway. And these effectively treat the symptoms of having a closed off airway or obstructed airway. And they also solve the problem of having the oxygen desaturation. So when it opens up your airway, it's allowing oxygen to be saturated into your body. So to conclude, in this speech, I talked about how there's many positives to having a good night's sleep, and how not getting a good night's sleep can affect your day-to-day life severely. I've also talked about some sleep disorders that prohibit you from getting a good night's sleep. Those are obstructive sleep apnea and central sleep apnea. And then I've also talked about some ways to move past the sleep apnea through the BiPAP and the CPAP. So that was my speech. My name is Tyler Bartell, and thank you.